Happy last Sunday of the month and welcome to our Sippin' My Tea. I appreciate you all joining. Let me ask you all to please share as you're watching so other people know to sign on. We are really trying to use this medium. I'm going to share it on my personal Facebook as I'm telling you to share. We're really trying to make sure that we use this medium as a way to communicate and get information out to people. And so I need you to help me do that by sharing it with your listserv. And, you know, by you sharing it doesn't necessarily mean, oh, I get down with Supervisor Mitchell or I agree with everything she says. It doesn't mean that. What it means is you also want your family, friends, and neighbors to know the facts and the information that's impacting our county. That's the whole point of Sipping My Tea, to get good, solid, fact-based information out. So by you sharing and helping us grow our numbers will help us do just that. So, you know, if you've been around, I started Sipping My Tea in 2019 during the pandemic when I was in the state legislature, and we used it as a way to give updates to let people know what was going on since we were all shut in. Became really pretty popular, and we realized it was another wonderful tool to use to share information. Sipping my tea because we're spilling the tea, and because I'm a tea drinker, so it was kind of funny. The tea I'm drinking today is something that was brought to me from one of my staff members, Sonia Lopez, who had the nerve to take a vacation this year. Sonia's so lucky. She went to a friend's wedding. She went across the pond and brought me this royal blend from the Fordham and Mason tea producers, established in 1707. That was probably some of the tea we dumped in the bay when we became our own country. How about that? So that's the tea I'm sipping. It's a strong, robust tea. That's my favorite. Again, I hope you're resharing. So because we're live tonight and we can pick up some additional listeners. Also, be sure and drop your questions in the chat as we go along so we can answer them in real time. The focus of this month's Sipping My Tea is a real conversation about policy decisions that are being made by other levels of government that impact us, and policy decisions that I'm trying to bring forward to the Board of Supervisors to really talk about what it's going to take to end health disparities impacting SPA 6, Service Planning Area 6. The county is divided up into SPAs. SPA 6, the second district is included in the second district, and it's a SPA that really suffers from health disparities. And two things. It's an issue that comes up often. I had the pleasure of just this morning going to the 80th anniversary and homecoming celebration of my own home church, Holman United Methodist Church. And there I am with still relatively new Reverend Franklin and Reverend Oliver, who just celebrated their 1-year anniversary leading the congregation. And so I just put that picture up because literally everywhere I go, people are talking about issues that are important to them. Someone stopped me there at the sanctuary to talk about what's happening with Martin Luther King Community Hospital. After church, I went to a social event, which is rare for me. I really enjoyed it with some girlfriends of mine who raised the issue about the budget and said, look, people are mad. People in our community are concerned about Kennehan Park being closed 2 days a week. And they were on social media saying, Holly Mitchell closed the park. And they were like, we were telling them Holly Mitchell didn't close the park. That's a budget decision. And I'm like, and a tough one. And so I'm hearing from people all the time wanting to understand the budget. You know, what's impacting me? Why are these budget decisions impacting my ability to access services in my community? So that's really what we're going to be talking about today. We had a board meeting a couple of weeks ago where we brought people together to talk about Martin Luther King Community Hospital. So today I'm honored to be joined by the leadership of King Hospital. Dr. Elaine, who's the CEO of the MLK Community Hospital, has been having some technical difficulties, so she may not be on yet. But we're also being joined by Dr. Atul Nakhasi, who's the VP of Government Relations for MLK. And we're going to be discussing how the Medicaid cuts from the federal level, you know, here in California, we call it Medi-Cal, but it's funded by Medicaid from the federal government, how the cuts will impact the hospital and how it's continuing to provide incredible care to residents in our most vulnerable populations. Dr. Nakhasi, thank you so much for joining me today.
Thank you, Supervisor Mitchell. It's wonderful to be here as I'm sipping my matcha green tea.
Okay, beautiful. Thank you. Thank you for playing along and having some tea. I appreciate that. You know, we invited you because, frankly, I have to tell you, your testimony was so powerful at our board meeting a couple of Tuesdays ago when we were deciding what we would talk about at Sipping My Tea. I was like, get Dr. Nakhasi, because you just, you get it. And I just thought your, how you chose to use your 1 minute in public testimony, which was hard, was very good. Let me get started in Dr. Batchlor's absence. And let me just, give a shout out. Dr. Elaine Batchlor is the supersonic CEO of this hospital, who's an amazing leader, someone I'm deeply proud to know and deeply proud of the fact that she is at the helm. She was there to reopen King and has been fighting for King and its staff and its patients ever since. So, Dr. Nakhasi, help me frame it. Let's start with, what does the hospital need? And frankly, kind of, how did we get here? People hear what is at risk of closing. I've seen a lot of social media posts, the hospital's going to close. And so I don't want to create unnecessary pandemonium, but I also need people to understand the seriousness of the situation. So tell us, how did we get here and what does the hospital need?
Yeah, thank you, Supervisor Mitchell. And you're so right. There's a deep and complex history. The hospital needs fair payments and space. That's what it really comes down to. Let me elaborate on both of that, the fair payments and the space. So start with the space. King Drew was a 400-bed hospital. We built this as a 131-bed hospital. So very, very undersized. And the projections, they just frankly did not estimate the amount of care needed within our community. And so I'll get very concrete here. You have a 131-bed hospital. We have 29 beds that are also in the emergency department. Yet we see 125,000 patients a year in our emergency room with those 29 beds. And so the projections had us at 25,000 visits a year in our ED. We're 5 times that number, and we got to do it with 29 beds. So the space has been a big issue, largely because there's been huge demand and need for good care in our community. And the emergency room is that point of care for so many people. So that's number one, how we got here with the space when we rebuilt the hospital. Number two, in terms of payments,
and before you go on from that, I understand, tell me if I'm wrong, that the guesstimate on, well, part of the hospital, the number of beds, was just really trying to, it's like when you buy a house, what can I afford? So we built what we could afford, what we thought we could pay for. But the determination of the size and how many people the ER would see daily was built on the number of people annually the ER was seeing before it closed, which really, frankly, wasn't an appropriate indicator to use, in my humble opinion, because we know that quality of care had slipped pretty significantly right before closure. So it wasn't seen as many people as it could have or should have. And now, given the stellar quality and these 5-star ratings the hospital is getting, people are comfortable and they're happy to have a top quality hospital in their community. So they're showing up. Is that an accurate depiction of history, how we got here?
That's exactly right. That's completely accurate, Supervisor Mitchell. And we're proud of the care we're delivering, the exceptional care and quality care that everyone deserves. And so you're right. Like, as that has happened, people are coming here, and it's been an overwhelming need for that care in our community that's above and beyond the capacity of the current infrastructure.
So, space and resources, and we're clear now about how we got there. So let's shift now to these current Medicaid cuts, which, again, the topic of conversation, many spaces I find myself, including today. So let's help the public better understand what the cuts to Medicaid by the federal government, what that looks like to a hospital like MLK Community Hospital. And, do you have a specific story you can share to help shine the light on a real life impact that this will have on patients you serve every day?
Yeah, that's such a good question, Supervisor Mitchell. So first, just kind of big picture, and we all know this quite well, is Medicaid is life-saving for so many individuals. It's now larger than Medicare. Many people may not know that. We got 71 million Americans on Medicaid across the United States, more than even Medicare, which is for seniors, as we know. So first, it's instrumental. My brother has been on Medicaid. My sister has been on Medicare. My spouse has been on Medicaid. And so, we all know someone who has been on Medicaid at some point or another. So, I think that's just an important acknowledgement of how important the program is. Now, going to what the policy did, we funded more tax cuts. That's what that bill did. And it asked, to fund more tax cuts for a lot of, corporations and wealthy individuals as well. How are we going to find that money? Well, the federal government went and looked at Medicaid, and it said, we're going to take $1 trillion with a T dollars over 10 years from that program to fund these tax cuts. And where did that money specifically come from? Getting down to like, how does this impact my patients? Well, 300 million of that was going to be through work restrictions, through losses of eligibility, through people losing their coverage and their insurance. That's the reality of it. The CBO projects 10 million people becoming uninsured over 10 years across the United States.
CBO is?
Congressional Budget Office. And so they make projections about how many individuals are going to lose insurance from this bill. That's across the United States, 10 million. And we know a lot of those will be here in California. So people, loss of coverage, that was about $300 million in cost savings they wanted to get out of Medicaid, out of that $1 trillion. The other 300 million that they're cutting are payments. They're payments to safety net providers, our rural hospitals, our urban safety net hospitals like MLK. And that is a real devastating situation. And I'll tell you why. I've had patients, and I still practice and see patients in South LA as a primary care doctor. I remember vividly, Supervisor Mitchell, I had a patient who had uncontrolled blood pressure. He was already on a couple medications, and he both had Medicaid and he had Medicare. And I needed to get him on one more blood pressure medication, a third one, so I can control that blood pressure. And we know that's important because blood pressure is a silent killer. It's one of the top reasons people get heart attacks and heart disease. Right. And it's a top killer in this country. I remember him coming to me and he said, Dr. Nakhasi, I don't know if I can afford this medication. He had a $2.50 copay, and he had to make the decision that day of using his $2.50 for his bus ride back home or for his third medication to control his blood pressure. Those are the decisions my patients struggle with, the decisions our community struggles with. And when we put up more barriers to care, like eligibility checks, like work requirements, we're reducing the care people need and deserve. And so it's going to have a real impact on our patients, on the coverage they have, on their care they can get. And we've seen that already before this bill took place, let alone with everything it's going to bring about. And then the last thing real quick is on the money it takes away from safety net providers. This very well as a fierce advocate for Medi-Cal and Medicaid, is that we've chronically underfunded it in the United States of America. Right.
The reimbursement rate has been so low.
Yes. It's so low. And so,
lower than the Medicare reimbursement rate.
Yep. It's lower than what we pay for care for seniors. It's lower what individuals with commercial insurance, those providers get paid. And so half of our hospital's budget, Supervisor Mitchell, is dependent on supplemental payments, add-ons. We're so under-resourced, half of our budget are add-on payments. And so now this big bill is affecting half of our budget. So that's the real life impact of what it's having.
So I'll bring it down a little more granular to the county. You've given us the federal perspective, the impact of the cuts on the state. Each supervisorial district has about 2 million people. LA County is 10 million. Of the 2 million residents that call the second district home, 850,000 are Medi-Cal beneficiaries. You talk about the work requirements. There's been work requirements in CalWorks and Medi-Cal all along. This is not about fraud and people gaming the system. It is not. It is about people like your patient that couldn't afford an additional $250 copay on a medication. You know, some Medi-Cal recipients are disabled. You know, back in my day when I lobbied for the Western Center on Poverty, you know, it was the aged, blind, disabled category. I mean, so I want people to really understand the meanness with which this policy is coming about. It would be one thing, Dr. Nakhasi, if we were in the middle of a recession, there were no resources, so we had to cut. I've lived through that, through the Great Recession when I entered the legislature in 2008. That's not what this is. This is a policy choice the federal administration is making. And the choice is between poor people, aged, blind, and disabled, and the top 1% getting another tax break. And poor people, the disabled, the aged, blind, and disabled lost to that population getting yet another tax break. You know, Sweet Alice Harris, you know, our long-term Watts Willowbrook resident, founder of Mothers of Watts, talked to some of my staffers after our hearing to talk to them about what it was like to live in her community before the first King Hospital was built, before the Watts uprising, which, you know, that hospital came out of a calling, a demand from that community. And so she talked about having witnessed and seen kids get hit by a car, and having to find someone with a car to transport them to, as she said, like my grandmother used to call it, Big General, because that was the only place they could go. That they even had difficulty back then, early 60s, to have ambulance service. And so while that feels like, oh, that was back then, Supervisor, it's not ancient history. It's still relatively recent history. And we certainly don't want to be in a position, I know I don't, with the resources of this country, state, county, and the need, the health disparities, and the fundamental need for people who live in that community, or anyone else that might find themselves in an auto accident driving down the Harbor Freeway, right?
That's right.
So we got the Medicaid big picture. Let me talk a little bit about Measure B, which is what we were trying to acknowledge and find some resources within at our board meeting 2 Tuesdays ago. So I'm going to read my notes because I want to make sure people get an accurate picture of what Measure B is in case people don't recall. So back in 2002, voters passed Measure B, and the goal was to avoid what was then the threatened shutdown of LA County's system of hospitals and other healthcare providers, all of which comprise what we call the county's trauma network. Measure B is paid for by property owners. It's an annual tax of 3 cents per square foot on structural improvements, not on your existing house, but if you do improvements, there's an additional 3 cents added to the tax. It brings in significant dollars. It brought in over $390 million in fiscal year 24-25. So the County Department of Health Services, looking at what is happening to us from the federal government, you know, predicting that the Medicaid cut was going to pass, and all of the other cuts that we are being impacted by, health services, public health, mental health, being impacted by. The Department of Health Services requested a tax increase to address those cuts, and it had to be passed by the Board of Supervisors. So the tax rate would result in an annual increase of $19.50 on average, on an average 1,500 square foot home. So the current adjusted annual assessment for county property owners would increase from $75 to $94. I know I muddled that a little bit, but the increase for county property owners would be about $19, just under $20. County operated hospitals receive the largest share of Measure B ongoing funds, roughly 70% of the funds, but non-county trauma centers receive between 16 to 17% of the funds. And the remaining Measure B funds go to a combination of physician services for indigents, county and city public health emergency medical services, fire departments, and other emergency agencies. And so what we saw, and so there are no private trauma facilities in the second district. However, second district constituents paid $60 million in Measure B taxes in 24-25. So Department of Health Services makes recommendations on a certain percentage of Measure B funds where it should go. And when we saw what we call a board letter, which is how DHS makes their recommendation to the board, there was no new funds recommended for MLK. I found that very curious, given all the stats we shared in that board meeting. MLK is a private hospital because when it was reopened, it's a county public-private partnership, county land, private hospital. So we have a working relationship. The vast majority of the patients you see are patients that if you didn't exist, they would be in a county public hospital. So they are our patients. So we fought to try to look at Measure B, what they call one-time dollars, to direct some resources to MLK, given all the reasons you talked about, given the fact that Measure B was created in a time such as this to try to avoid closure of hospitals. And so we were asking for $9 million of Measure B funds to be allocated to MLK. Because this is a part of my effort to do all that I can to make sure that this hospital that is providing top quality services, you get these 5-star ratings on all the amazing indicators. When we look at your Black and Latino maternal health outcomes, they're so positive, and we know what that disparity looks like, particularly for Black women. When I look at your success rate during COVID, when I look at your treatment of those with heart disease, diabetes, I mean, you all are performing top flight, and that makes me deeply proud. So I'm doing all that I can to make sure you have the resources you need to continue to provide services to LA. So you spoke at that board meeting. Sweet Alice was there. It was a bunch of people because we needed to convince the board to help us by amending this board letter by asking for $9 million. There were a couple of counter proposals that came up. I did a full PowerPoint presentation to make sure everybody is clear. SPA 6 is a health desert. MLK is like number 2 in the entire county in terms of serving Medi-Cal beneficiaries. We laid it out, right?
We laid it out.
We laid it out. But you spoke eloquently on the wide range of LA County residents who rely on the hospital. In addition to South LA, you listed many neighboring cities and communities. So help us better understand the geographic reach of this hospital and why it's so critical for our overall health infrastructure. So this, for me, it's like, you know, the domino effect. Yep. MLK goes down. You mentioned 125,000 people in an ER. Where do those people go for emergency services? They're not all going to Catalina or any of the other neighboring hospitals. So walk us through the other geographic areas. You did it so well at the board meeting. I want everybody to hear it as well.
Thank you, Supervisor Mitchell. And that's so right. And, you know, there are so many individuals across Los Angeles County who depend on care at MLK Community Hospital. In fact, most people may not know this. More than 1 in 5 of individuals who walk through our doors are outside Supervisorial District 2. More than 1 in 5. And so they're coming from all over the community. And in fact, Supervisor Mitchell, I have a patient I've been caring for almost a decade in South LA who comes from Lancaster. And one day I asked him, I said, you know, you're coming all the way from Lancaster. Why? I was curious, right? That's a commute if you're talking about LA, Los Angeles County. He said, I have always come there and I get great care. I always have come there and I get great care. And so as people move, as they relocate, as they establish care here and they get the exceptional care they do from MLKCH, they want to come back. They want to come back to our emergency rooms. They want to come back to our hospital, and they want that great exceptional care since the rebuild and the reopen. And so I think it speaks to how so much of the patient population we care for is even well beyond Supervisorial District 2. And Supervisor Mitchell, you hit it on the head. What happens if we were to not be there? Where will 125,000 people go every year?
Dr. Batchlor.
Y'all don't need me.
We really don't. Because Dr. Nakhasi, and I've done my homework on the hospital.
I know.
But I'm glad you joined us. Welcome to Sipping My Tea. Thank you for joining us. I know you had a little bug you had to work out, but
my IT people have secured our devices so well, we can't get onto anything.
So that means you won't be hacked. Good for you.
That's right. I literally have to call them and say, please let me in.
I'll know where to come if I get hacked. I'll know that there'll be one place that'll have the secure communication with the world.
Yep. And
you
are new, so you have that to look forward to.
Yeah.
So Dr. Batchlor, we've talked about how we got here. We've talked about the Medicaid cuts. I tried to give a high level yet in plain English explanation of Measure B. And, public policy isn't always easy to explain in plain language. But I was just challenged by a girlfriend of mine just a couple of hours ago. Holly, you have to make the budget plain in language so people hear it, understand it, and trust the source. So I'm doing all I can to make it as accessible and plain as I can. You hear me, Connie? I'm trying. So Dr. Batchlor, as the amazing CEO of the hospital, you've really been an integral part of its recognition over the years, over its success. Share some of we just heard about somebody traveling, 100 miles easily to continue to be Dr. Nakhasi's patient, which he's been for 10 years. Could you talk to us about some of these high ratings in healthcare service that people may not be aware of, and the strides the hospital is making in delivering quality healthcare to hundreds of thousands of people every day? We're trying to recruit additional raving fans. So let's give them the data. They can go out and help us spread the good news.
Absolutely. Well, the first thing I want to say is that quality and excellence is our number one priority. So that is the reason that we get up in the morning and what we think about when we go to bed at night. And we like to say that we have become victims of our own success.
Exactly.
Because we have done so well at taking care of patients and providing a safe and supportive place for people to receive care and recover, that the community trusts us, and it has translated into more and more people coming to us for their care. We've worked hard to earn an A rating for patient safety that is given out by the Leapfrog Group. It's a national group that rates hospitals on patient safety. We've worked hard to achieve 5-star ratings from the Center for Medicaid and Medicare Services, and those ratings are based on quality and patient satisfaction. We've worked hard to be on the honor roll every year for maternity care that is given out by the state of California. Even when we first opened, we were pleased to earn a top rating for use of information technology to support quality and patient safety. So we've continued to work along all of those fronts. And, what do those ratings mean? Well, they're things like not having people in the hospital get infections.
Mm-hmm.
That is part of the Leapfrog rating, or using scanners to distribute medications so that you don't have errors in distributing medication. So it's things like that. It's where we've invested in technology and where we've developed the right protocols to provide the best care. It's also the selection of our staff, of our doctors, of our nurses, people like Dr. Nakhasi, who is, he may not tell you this, but he's a graduate of Johns Hopkins Medical School and has a graduate degree from Harvard. So we're looking for the best on all of those fronts. And we're proud of that.
And so am I. Particularly when you consider how hard it is, how, as I have learned, how few hospitals, public or private, are able to maintain those designations. And certainly a hospital like yours, that's still relatively new, in a service planning area with such high health disparity and high need. You know, you and I talk about all the time that by the time someone gets to your ER, we still haven't built up equitably the health prevention services infrastructure in that community. So, you know, people are still using the ER as their point of entry far too often in terms of accessing healthcare services. So given all of that, you're still top class.
Well, I'm not going to say that it's easy. And, you know, it's certainly a challenge every day, but it's what we are striving for. And as you point out, you know, we have the challenge of not enough primary care in the surrounding community, you know, insufficient access to prevention, to disease management. And we're also challenged by not having enough space to do our work. So, you know, given all those challenges, it's not easy, but it's the thing that we think matters the most. And so that's what we've made a priority.
I appreciate that. Since we're live tonight, we've had some questions come in. Let me see. Let's see. There's one question. How can we fight more? And this is from Crystal Jones. How can we fight more?
Well, I can tell you that, you know, from our perspective, one of the things that we think is really super important is letting people know about the unmet needs of our community. So really shining a light on it and letting people know what's happening, what isn't happening, you know, the shortage of physicians, the lack of access, you know, letting people know that both through the data and through the stories about individual people. So we think that's really critical.
Yeah,
I agree.
And I'll just build on that if I may, Dr. Batchlor. I think that's such an accurate point. And we saw, Supervisor Mitchell, as you did too, and we witnessed the power of when people show up. And we saw that at the board meeting, right? When we had more than 100 people from across this community sign up to share their stories, to share their tears, to share their incredible journeys of care they've received from our community and our hospital. So I think continuing to show up as the hospital is needed, the community has been incredible, and just a tremendous gratitude for all those, and for you, Supervisor Mitchell, for all the incredible work that's really making a difference to allow us not just to survive, but to thrive.
Anything that we didn't touch on that you want to make sure that we're able to share? We're going to wrap this up. The beauty of Sippin' My Tea is supposed to be brief, just 20 minutes or so on your Sunday evening. So anything I didn't ask you that you really want to make sure that people know?
Well, I guess one thing I want people to know is that it is completely possible to provide high quality, accessible healthcare to a low income community like South LA. It is not a goal that we have to give up on. We can do it. We've been doing it, and we intend to continue to do it. So I think people really need to understand that it is possible, and it's something we all need to continue to strive for.
I agree. Let's see. They're texting me that there's some additional questions from the audience. Okay. What can we do to compel the county and state to fill the chasm that will be created by the devastating cuts to Medicaid? The wealthiest Californians and corporations need to pay more. Equity is so important. Thank you, Disa. I agree. Well, I think a part of what we tried to do at the county level is one, it's not the whole solution, but it's one solution, was looking at the Measure B dollars, which made perfect sense to me because that's what Measure B was designed for. I think the other challenge that the state is facing, Disa, is, it rolls downhill, and the state is confronted with the cuts from the federal government. You know, the federal government establishes the program, state administers it, right? County provides the service. We operationalize it. And so when it stops rolling from the federal government, it screws the state budget and it screws the county budget. So I think what we have to do, you know, I will go so far as to say elections have consequences. And, you know, you've got to let, you know, the state legislators from that represent, that touch the second supervisorial district, they get it. They know about that 850,000 members. Their numbers are the same. You know, I have to say, the district, the congressional district with the highest number of Medicaid recipients in the country is in California. It's in the Central Valley. And that congressional rep, Congress member Valadea, voted for the big, ugly bill. So it's not just in our community. We have to, DISA, you know, reach out to our family, friends, and neighbors across the state, across the country, because everybody has to understand the detrimental impact of their policy decision. It wasn't a fiscal necessity. It was a choice they made. Dr. Batchlor.
I was just going to say, I feel like I have to add in here. We are an incredibly wealthy nation. We have enough resources as a nation to take care of everyone. It's really a matter of political will and choices that we make. You know, the choices we make about what we are going to invest in and what we're not going to invest in. And as you said, elections have consequences. So we need to elect people who have the values that we share for investing in the health of our population. And we should not fall for the myth that we don't have enough resources. We do have enough resources. This is the richest country in the world. We can take care of everyone if we do the right thing.
And, you know, we talk about that a lot, Dr. Batchlor. And I think for me, what's even different this time, and I said it a little earlier in our Sippin our tea experience, you know, when I got to the legislature in 2008, we were in the Great Recession. And so resources were squeezed. And so we had to make tough choices. That's not what's driving this. It's not about there aren't resources. It's about they made a choice.
Yep.
Medicaid recipients or the top 1% getting another tax break. So we are giving them money back, those who need more money the least, and taking it from a healthcare delivery system. And what people seem to fail to realize, let's say you, based on your lived experience, the community you live in, whatever, you never need an MLK community hospital. But this is like the domino effect when you talk about healthcare. It's the overall county health infrastructure, which was Measure B was passed to support. And if we take not only an MLK community hospital out, but others that will be impacted by this Medicaid cut, it compromises the entire infrastructure.
It does. And it also drives costs up for everyone. So people don't realize that we're all connected. And when a hospital doesn't get paid by Medicaid for taking care of patients, it adds that expense to what it charges private commercial insurance. And everyone's private rates go up. So it's not a problem that can be isolated to low-income communities. We are all connected in our healthcare system.
I agree. I appreciate you both so much for taking out the time, for breaking it down, for helping us understand the impact of Medicaid, helping us understand the needs of the hospital in terms of resources and space. You know that I will continue to do all I can to work in partnership with you, because I am clear that the people who call the second district home would demand that of me, expect that of me, as they should, because it's what we need. As I said in board meeting, you know, if health disparity were equally distributed across 5 districts, I would understand a divide by 5 strategy of Measure B, but that's not what happens.
Nope.
And equity is not based on a divide by 5 methodology.
Nope.
So we are going to continue in LA County to fight for equity, to make sure that communities that have a disproportionate negative health outcomes, have limited access to resources, have an equity-based investment of public resources to keep them whole and healthy so they can thrive. Thank you both.
For that. Thank you for that. LA County and district, the district that you represent, is so fortunate to have such a passionate, articulate advocate in you. You blew me away at the meeting, the Board of Supervisors meeting, with the way that you talked about health equity and, doing what's right. I really appreciated it so much. It made the hair on the back of my neck stand up.
Thank you, Dr. Coming from you, that means a great deal to me, but let me just say, it's what I'm supposed to do. I'm crystal clear. Thank you both for joining me. I'm going to give you the rest of your Sunday evening back, and happy sipping my tea. Thank you for joining me.
Thank you.
Thank you, Supervisor.
Thank you. Thank you all for joining us and hanging out a little longer. This was an important conversation to have as I sip my tea, sitting here in my kitchen. Before I go, I want to make sure everybody is aware of our upcoming Racial Justice Learning Exchange. It's on Wednesday, August 6th at 4 o'clock. This is our 3rd year of doing these amazing RGLE experiences. And I love it. Every RGLE, every month I ask, how many of you, this is your first time? And, dozens of hands go up. So new people are coming into the fold. We're reading a book. Is this my copy? Is this it? Yes, here is my copy. There it is. I haven't started it yet because my book club, my personal book club, just met Friday, and I barely got through that book in time. So I'm going to start this tonight. Brown and Gay in LA, The Lives of Immigrant Sons by Anthony Christian Ocampo. We're going to be at Jules Catch 1. We'll be at the Catch right here in the 2nd District. And again, queer stories, racial truths, collective joy. The whole part of Racial Justice Learning Exchange is to learn something about a community that you may not be a member of, but choose to be informed and learn new things so you can be an ally too. So I hope that you will join us in reading the book. And even if you don't read the book, it's not that kind of thing. If you don't read the book, come anyway. You will still get a great deal from the experience. So again, Sippin' My Tea is always the last Sunday of the month. We start at 6 o'clock. We went a little long tonight, but we had meaty stuff to try to get through. Measure B, MLK Community Hospital, Medicaid cuts, all the above. I'll see you here again on Sunday, August 31st for Sippin' My Tea. Thank you and good night.